Hello, I'm Dr. Tracy Mountford, and today I'm talking to Mr. Tahir Hussain, who is a consultant vascular surgeon, and I'm going to be asking him all things to do with varicose veins and all things vascular, which is a subject very close to my heart, which I'll talk about later. But welcome, Mr. Hussain. Thank you for spending the time in your busy day for talking to me, because it's a subject I think that is a very important one for many women and men. And is not fully understood in terms of what causes the problem, in terms of varicose veins, and also what the treatments are that are available now. So would you mind just briefly for the people who are going to be watching this video, just tell us about yourself and your credentials?
Okay, so my name's Tahir Hussain. I'm a consultant vascular surgeon in the NHS in the private sector, and also a Hunterian professor of the Royal College. I've been treating varicose veins as a consultant for 20 years now, and working for the private clinic for about 7 years. I'm interested in all aspects of varicose vein treatment. There are a lot of new treatments which have come on the market recently, and they certainly have a place. I'm also involved in the research of varicose veins and really looking at outcomes and seeing what is the best treatment for an individual person. And also we do a lot of treatment on the national health as well, because if you leave varicose veins alone, you can get skin ulceration and skin changes. And that type of treatment is still available in the national health, where some of the vein treatments which manifest itself earlier on with unsightly veins are not available in the NHS.
Yeah, no, that's really interesting. And as we spoke privately earlier, and I said to you, this is a genuine subject close to my heart, because I have had treatment for varicose veins. I had both legs done, both long and short saphenous systems. I had the whole Monty done. What I'd like to know, and I'm sure my patients would like to know, is the majority of my database is female, but obviously it affects men and women. Can you just tell us, is it genetics? Is it lifestyle, or is it the combination?
Okay, so it's a genetic condition. It affects 1 in 3 people. So it's one of the most common conditions in people. And there was a prevalent study, so there's a study looking at the number of people who have veins. In fact, actually, men suffer more with veins than women, but women go to their doctor more than men do, as men often just hide them underneath their trousers. And that was a study done in Edinburgh, which looked at the prevalence of varicose veins. Veins are common because we, as human beings, stand on 2 legs rather than on 4 legs. The heart is quite a long distance from our feet. And we have these one-way valves within the venous system. And in almost of a third of the population, these valves at some stage in their life will become defective. And that's what really causes varicose veins. It's a defective valve problem. We don't know why these valves become defective. But if you imagine just from a gravity point of view, when you're standing up, the blood, if you don't have these valves, are going to pool in your legs. The classical symptoms of veins, apart from unsightliness, is the legs will feel heavy, particularly at the end of the day when you've been on your feet a long time.
Yeah, that's really, really interesting, because, and again, it's just because I have a personal interest as well. I mean, I do think for women, and I hope I'm speaking generally, yes, it is a genuine problem, but from an aesthetic point of view, it's really quite demoralizing. You know, there's some women can't even wear stockings or tights, will always cover their legs up, and it's a really big problem. The time when I realized I had a really, really big problem was when I started to get itching and skin changes in my ankles. Can you just talk us briefly about the kind of changes that can also subsequently occur when people leave these things? You know, they say it's just cosmetic, it doesn't matter really, I won't have anything done. Well, what are the actual quite serious complications that can occur if you leave them alone?
Yeah, so if you look at people who've got venous ulcers and skin changes, they've often had veins for decades. And originally they don't cause much symptoms. But as you can imagine, over a period of time, with that blood pooling in your legs, it can cause the symptoms you see. The itchiness is due to the fact that it's deoxygenated blood in the veins that causes the itchiness. And the skin changes is because these little capillaries burst the blood from there and actually causes dark brown patches on the skin. And so if you leave veins alone for many, many years, they will cause ulcers and eczema and itchiness and become very, very troublesome. And also, if you look at the National Health, we spend almost £20 million a year looking after people with leg ulcers. And once you've got a leg ulcer, the treatment is quite difficult. You may need to have dressings regularly, the nurse coming out to see you. And the warning signs for that are itchiness and brown patches on the skin.
Yeah, I got that. It's quite interesting. I'd left it quite late, which is fascinating. Before we talk about treatment, because I'm fascinated by the new treatments that are available, can I ask you about the way you diagnose? Because in our clinic, we get people coming through with thread veins, the classic thread veins. And of course, the mistake that can easily be fallen into is that, as practitioners who are not vascular surgeons, I mean, we don't do this, we refer on to colleagues, but as non-vascular surgeons, it's easy to just start treating the thread veins without looking at what's causing the problem. So can you tell us about why it's so important to diagnose correctly?
Yeah, so thread veins is another area. It's a subset of varicose veins and is a whole different ballgame. But some patients who have thread veins would also have varicose veins, and it's an early manifestation of varicose veins. And if you go and have like simple treatment for thread veins, which is laser treatment or what's called sclerotherapy, you may actually just be not utilizing your money effectively because you're not having the underlying problem sorted out. But not everybody with thread veins have underlying veins. So the thread veins is a different area. The main way of looking at veins and diagnosing varicose veins, obviously a clinical examination, and then something called an ultrasound scan, which is done by a vascular surgeon or a vascular specialist. And that will look to see where the leaky valves are and what the trouble is. It's also important to have a scan to make sure you don't have any underlying deep vein problem, because in the leg, we have two systems of vein, the deep and the superficial. And the superficial is what causes varicose veins. And this is from evolution. We have a redundant system of veins in our legs, which are much more important in animals than it is in humans, because we're not going to be running at 30 or 40 miles an hour. And you need two systems if you're going to be doing that on a regular basis, such as the lion or the cheetah or the deer. Humans don't run that far apart from pleasure, so they don't really need this extra system. It's important to look at the deep system to make sure you don't have a deep vein thrombosis or deep vein issues. Some people who've had a broken leg in the past or have been in hospital may have had an underlying deep vein thrombosis, and it's important to look for those. That is a small group. But once you scan the people, then you can see where the valves are defective, and then you can go and treat that. Now, the mainstay of previous treatment used to be stripping, which everyone knows about. And a lot of people didn't want to have stripping because it's a painful procedure. It's done under general anesthetic. And often people said the veins came back again. And that's because we didn't scan them. But now we scan people, we can now target treatment much more effectively.
I know I have people and friends that have, had stripping in the past. And of course, it's not been successful particularly, but it was the best that there was then. Talking about new treatments, so the way that now you would approach treatments, how you would choose certain things for different people, and how that has improved for patient outcomes and downtime, etc. So if you could just talk me through the different techniques that are now currently available.
We don't do stripping anymore, and I don't think most people in the UK do stripping, which is a general anaesthetic procedure. Most veins are treated a bit like going to the dentist and having some local anaesthetic. The mainstay of treatment is to close the main vein in your leg using thermal damage. And that thermal damage can be given by laser, or it can be given by what's called radio frequency. So both those treatments are equally as effective, and we do a lot of that. It involves 2 or 3 millimeter incisions and giving local anesthetic to the leg, and then wrapping the leg up, and then wearing a stocking for a couple of weeks. And we've done studies looking at that treatment up to 5 years, and we've shown that the success rate is 95%, which is better than anything out there. But what's happened recently is that because you have to give local anesthetic, which can be painful, it's a series of half a dozen to a dozen injections. There are new treatments on the market which basically involve closing the vein without giving those extra injections. And the main interesting area there is something called glue treatment. So instead of burning the vein and closing the vein, you can actually just glue the vein closed. Now, glues have been used in the National Health and in medicine for over 70 years. So it's not something that is foreign to medicine. We're just using it in a different way for varicose veins. It's a very effective treatment, and the main advantage is you may not need to wear stockings at all.
Wow.
Not suitable for everybody, and so you have to be assessed by a vascular surgeon to see if it's suitable. So it's something that's there for people who don't want to have multiple injections and who've got suitable veins. And I think it's a really good treatment. There are other treatments out there, such as sclerotherapy, foam sclerotherapy, and there is even steam. People are using steam now to damage the veins. So there are a lot of new interesting areas coming on the market.
That's really interesting, because I had laser and it was fine. It was very easy. I think a lot of people are worried about having stuff done. Certainly big veins. I think, God, how can you have those done under local? But actually, as you say, now it's pretty comfortable. Can I just ask you, without getting too deep into it, what would make someone not suitable for glue, or is it quite a complex assessment?
It is a complex assessment.
Okay.
If the vein is too near the skin, so somebody's very slim, doesn't have a lot of subcutaneous fat, then glue isn't suitable, because you don't want to be putting glue too near the skin, because you can get something called phlebitis. Yeah. If the vein is quite deep, then you're suitable. I had glue done to my veins rather than laser. And basically an hour later, I was up and around and absolutely fine. So I've done glue on people. I've done it to myself. And what's really interesting, I know 5 vascular surgeons who have had veins, and all of them have had glue, which is really
that says a lot, doesn't it?
It says a lot, that's right. Radiofrequency and laser have been around for almost 20 years, and we know the results. And there's been hundreds of studies showing at 5 years the results are 95%. With glue, there are not many studies more than 2 years old. And that is the thing. It's so new. I can't tell a patient, and I tell them that when I consent them, that I don't know what the 5-year results are, because no.
No, but I think people would be prepared. I think that's something that most people would be prepared to take on. I certainly would, if it meant that my downtime was shorter. I had to wear, and potentially not wear compression garments or bandaging. I think I would take that on. Can we just touch on, as medics, we can never get away from adverse events and side effects. If we're in medicine, they exist, and patients need to take this on. We won't dwell on this, but just top line, things that perhaps patients should be aware of.
Okay, so NICE, which is the National Institute of Clinical Excellence, and they approved glue last March. And what they said in their report was the incidence of side effects are no worse or better than any other treatment. And that, I think, is important to know. So I don't think the incidence of complications are any worse. And the complication rate is phlebitis is the most common one, failure of the treatment, and the very, very rare complication of a deep vein thrombosis, but it's very rare. But the incidence of DVT, which is interesting, is no different to laser or RFA, which is as a mainstay of treatment in the UK. So the fact that our governing body, the National Institute of Clinical Excellence, have approved it means that I think it's a safe procedure, provided the surgeon is skilled enough in doing it.
And about how long does the procedure take? I mean, again, I know it will vary from whether it's 2 legs, 1 leg, whatever, but on average, what would a patient expect, to be lying on the bed?
About 30 minutes to 45 minutes of treatment. It's actually no quicker than laser or any of the other treatments, which are all about 45 minutes. The thing is, it just involves less injections. So it's definitely less painful. It's difficult to compare, because obviously you're only going to be doing 1 leg in that person. So you can't do a study to say, is it less painful, unless the person has glue on 1 leg and laser on the other. But from my experience, I think it's a less painful procedure.
No, it's very interesting. So can we just touch on thread veins, because they are a big bane of a lot of women's lives. So do you think that in terms of sclerotherapy, I think people get very confused and are slightly misled as well. Patients can be, they think it's one and done. They think, just a session of treatment and it's absolutely fantastic. What would a patient be expecting from number of sessions? I know it varies, but on average, I know it's not one and done, and I think patients need to understand that. And the likelihood of those thread veins coming back.
Yes, so thread veins is an interesting area. I don't personally feel, as a vascular surgeon, been doing this for 20 years, that any treatment is fantastic out there for thread veins. And I wish we could come up with a better treatment. And I think possibly because it's a cosmetic issue, we haven't done the research in that we should be doing. So because it's more cosmetic rather than actual medical, there's not been much research. But the mainstay of treatment has been around for more than 50 years, which is sclerotherapy. It's the same drug that's been used for 50 years. And having been on courses and seeing people do it and doing it myself, I always give people what I call realistic expectations. If they come in expecting their legs going to be completely normal, I just tell them that's not what I can offer you. We can certainly make them look better and less obvious, and often people are happy with that, but there's nothing out there, and I've tried all of them, laser and everything else, that's going to give you perfect legs. Sclerotherapy is the mainstay of treatment, normally 3 or 4 sessions. And what I say to people, it is cosmetic. It's part of the aging process. As we all get older, and I'm now getting old, you get wrinkles and you get other things. It's the loss of the collagen within the skin that causes these veins to become more obvious. And these veins have been there throughout your entire life. And as you get older, you lose elasticity and the collagen within your skin, and the veins become more obvious. And actually, as you get older, you're going to get more veins. So having an area treated, you may get more veins somewhere else. So I think it's really important that although treatments are good, to give people realistic expectations. And I think the people who get disappointed are people who haven't been, in my opinion, consented properly. And I think that's really the important thing. It's just realistic expectations. There's nothing really out there which is amazing.
No, and I think that's the general rule for everything, isn't it? Most people are only disappointed because the initial consultation failed in some way. And now to get on to the thing that people will ask me, because they'll be interested in this. I'm genuinely interested. In fact, I'm going to sneakily, so I'm going to declare it very honestly, I've got an appointment booked with you very shortly, Mr. Hussain, because my veins are not looking good. But just to give people a ballpark idea of cost, because obviously a lot of patients will come in for the aesthetic requirements. They will be coming in because they want something that's innovative, that's new. What kind of fee? I know this is bespoke, it's on an individual basis, but what is the kind of fee people perhaps would be expecting to pay for a very sophisticated vein treatment like you've been suggesting to us today, like glue?
I think this is off the cuff of my head. I can't actually remember the Varicose, but I think it's around between £2,000 and £3,000 per leg. And I think if you're having both legs treatment, it's about 20% cheaper than that. So it's around about £3,500 for 2 legs. I think for sclerotherapy, for 3 sessions, it's around about £800 for 3 sessions of sclerotherapy. So it's in that area. The glue therapy is a little bit more expensive because it's so new, it's just come on the market. Although the company have reduced the cost of the glue is more than the cost for the laser. But the costs are coming down, and they've come down from they were a year ago. And that's an important thing. But I think if you're having bilateral treatment, I don't think the glue treatment is any more expensive than bilateral laser. It's only if you're having one leg done.
And from what you said, I think I know the answer, but I'm not going to assume. So before, with any treatments on legs, we're saying do it in winter because, spring and summer's coming and get it done really quickly. Is now the right time of year to do this sort of stuff? Obviously, you're telling us the recovery is pretty quick with this kind of stuff now, and the downtime is, very little. But would you say now is the right time to consider doing it?
Well, I think often you want to get your legs ready for the summer. Certainly what we say to people with any form of treatment is don't want to expose your legs to ultraviolet light for 2 weeks after surgery. So you don't want to be having treatment a couple of weeks before a holiday. Although the incisions are very small, 1 or 2 millimeter incision, they're going to look a little bit pink because it is an incision for a number of months. In the winter, we're all covering our legs with trousers and stockings and tights, etc. So it's an ideal opportunity now if you've been suffering from veins for many years. I think the other important thing is the treatment for varicose vein is simpler the earlier you come. As you leave it longer and longer, treatments become more complicated and the results probably aren't as good. And therefore, I do recommend to people to get their treatment, if they've got varicose vein, get their treatment done sooner rather than later, because you get skin changes and various other things if you leave it a long time. And there was a study done by the government, actually, because we were actually trying to lobby the government to actually allow us to do more varicose veins on the NHS, because unfortunately, the NHS is not doing much varicose veins. And you know that with coronavirus, they're only treating life-threatening emergencies. And one of the studies we did, which I think is a really interesting study, was after varicose veins treatment, the satisfaction rate is 95%. Mm-hmm. So I, as a vascular surgeon, want to be doing treatments where people are happy. And I would say that 95% of my patients are happy. And I think that's an important thing for people to realize. People often say to me, oh, my legs feel much better now. But have you not realized that there was an ache in there before? Their legs feel lighter, they feel better.
Yes.
But because they've been going over such a long time, the chronicity is long, they just get used to it. They get used to the heavy feeling of their legs. And that, I think, is a really interesting area.
Yeah, do you know what? Now you've reminded me of that. I definitely was getting that. So you do get used to it. You get used to that slightly, I'm going to put a horrible word on it, slightly wobbly, heavy feeling to your legs. And you just think you've got more cellulite, but it's not, it's just that wobbly, heavy feeling. Do you think, I mean, this is a bit of a frivolous question, but I'm just intrigued. Are the legs bigger? Are they circumferentially bigger if you have varicose veins due to poor drainage?
They certainly can be. They're not in everyone. But we do get a lot of people with lower limb swelling, and that swelling disappears after they've had the treatment, but it's not in all cases.
No, I'm just intrigued. And just to wrap up, and just say, people who've had previous varicose vein treatment, there may be people listening here who've had treatment. They might have had treatment, the traditional way, the stripping. They may have even had, EVLA or RF, and it's not been as successful as they hoped. All kinds of people. Would those people still be suitable potentially for glue or other treatments, or would it mean that their outcomes would not be as good on subsequent treatment?
Certainly the outcomes would be very good with new treatments, and certainly, for example, it's a very common operation. If I say 1 in 3 people suffer from varicose veins, and 5% is 1 in 20 come back no matter what treatment. So there's a big group of people out there with what I call recurrent varicose veins. And in the past, certainly the insurance company would charge a lot more for recurrent treatment, but we actually don't charge any more. They're treated. We charge just the same because the treatments are the same. And I would recommend those people coming forward because we can improve the cosmetic side of things, and certainly they may get some functional improvement. You won't know what type of treatment will be required until you've scanned the patient. And had a consultation. And sometimes I often say, you don't need any more treatment. You just got a few visible veins, which cosmetically we can improve, but you may not. Or sometimes I say, well, unfortunately, the EVLA or the stripping hasn't worked and we need to go on and do something bigger.
Yes, thank you very much, Mr. Hussain. That was really, really interesting. I've learned a lot. And as I said to you before, many times during this, it's a subject close to my heart. It's certainly something we're asked about a lot at the clinic by patients. They don't like the unsightly nature of their veins and also the way it feels. And we're looking forward to you coming to do some clinics regularly at the Cosmetic Skin Clinic. We have those dates for patients if you want to ring us, and we have the fees for consultation. Mr. Hussain is doing something special for our patients. So I'm really looking forward to seeing you there, and I'm sure you'll be inundated. Thank you so much for your time today.